Now I would like to invite Rebecca from Florida Health Justice Project.
Thank you, Sean Mook. Hi, my name is Rebecca Burstein, and I'm here helping the Florida Health Justice Project in illustrating and identifying healthcare coverage gaps across Florida. Now, access to affordable healthcare is an issue that affects us all. Today, I'm going to be telling you real stories about real people living right here in Florida. Miriam, a mother of 2 living in Miami. Miriam thought her fight was over after surviving cancer and getting a job with health insurance. Miriam then lost her health insurance after losing her job due to COVID-19. This means that she's going to be paying off debt for years to come. Michael, a young man from Orlando, Florida, is a small business owner but still doesn't have any health insurance. He does, however, have a health condition, the worst of which being his asthma. While Michael tries to scrape together just enough money each month to afford his inhalers, he's only able to afford ones off the black market. Shirley, a resident living right here in Jacksonville, Florida. Shirley suffered a horrible stroke, causing her to be bedridden. Without the help of in-home health aides and a chairlift, she can't get out of bed. On weekends, she is trapped and alone. So the state of our health insurance. There are 2 million people here in Florida without health insurance. Now, healthcare coverage is extremely important because our health is important. Having a healthy community is important. From a 2023 Florida Blue survey of uninsured Floridians, 70% of uninsured people believe that they could not afford health insurance. According to the U.S. Census Bureau, 1 in every 8 Floridians under the age of 65 are uninsured. That's 13.9% of the population versus the 9.5% nationwide. Now, Florida Health Justice Project. This issue is the beating heart of our partner organization. That's why they participate in advocacy, litigation, and education in order to help people just like Michael, Miriam, and Shirley. Now, project goals. This is why Florida Health Justice Project came to us to help their goal of illustrating and identifying healthcare coverage gaps in Florida. Now, we want them to be able to leverage this public healthcare data that we have just put in their back pocket with dashboards from Tableau that show them easily accessible data that they can bring to stakeholders and policymakers in order to help them identify the uninsured populations. Now I'm going to hand it over to John for more about our health data. Thank you.
Hard act to follow. All right, so when Florida Health Justice Project came to us, they wanted to get information on the healthcare coverage gap. Now, for the uninitiated, that is a sticky situation to be in where an individual or household makes something above the 100% of the federal poverty level, which is defined by, and I forgot. Anyway, so if you make above that amount, you don't qualify for Medicaid. But also, if you make under 138% of the federal poverty level, then you more than likely won't be able to qualify for the marketplace. Oh. So you won't qualify for Medicaid, and you also won't qualify for the subsidies provided by the marketplace or private coverage. This leaves individuals or households in the relevant case without coverage. Now, to better wrap our head around this, we gathered public sources such as the American Community Survey, which if you were paying attention to the last project, you already know about, county health rankings, which is a really good resource, Florida Health Charts, another very good resource, and we dug through this information, and we selected variables that we thought would be relevant to addressing this problem, and filtered more than hundreds of variables into hundreds of variables. Continuing on from that, preparing this data allowed us to perform correlations and analysis. Doing this helped us to understand which of the variables would be most important for how we wanted to proceed. Having identified those variables, we had to turn them into a story. For that story, we have decided on 3 lenses, the first being health, second being demographics, and the third being economics. For these dashboards, we're going to be exploring these lenses, exploring these perspectives with the lenses of the dashboard, with intuitive user design and user-oriented design again. Anyway, so to guide us on that journey, I'm going to be inviting our wonderful team lead, Michael Mezzano, to take you guys through that. So, big round of applause for him.
Hello, everybody. My name is Michael Mezzano. As John said, I'll be taking you through some of the dashboards that we worked with Florida Health Justice Project to help illustrate the scores of data that are available to help us understand better the issue of uninsurance and health data across the state. The first of these 3 dashboards we're going to look at focuses on health. So on the left, you can see a map where counties in red are those with the highest rates of uninsured adults in the coverage gap. So any county that you see in red are those that have more of those uninsured adults in that specific age group and federal poverty level. On the right side, we can see health outcomes for the state or an individual county or region if we select those. So we're going to go ahead and use one of the filters on the right side, and we're going to look at Northeast Florida. Now, when we view Northeast Florida, we can see that the health outcomes have gone up in terms of mortality and other negative health outcomes that we see here. This indicates that in this part of the state, people are experiencing worse health outcomes. We can select all to go back to our full view of the state, and we might be interested in investigating a particular county, perhaps one of our red-colored counties. So we're going to look at Columbia County. Now, when we go to Columbia County, we can see on the right side that the rate of uninsured adults in the gap is 36%. We can also see that compared to the state of Florida at large, the rate of mortality for both adults and infants with these metrics is 1.5 times higher than the state. So in this way, we're able to quickly understand which counties are experiencing those high rates of uninsured adults in the gap alongside the health outcomes that they're struggling with. But we might be interested in the uninsured demographics of Columbia County. So that's what we can look at in our next dashboard. What this dashboard provides is a snapshot of the most uninsured demographics in a county. So looking here at Columbia, we can see that in terms of age groups, 19 to 25-year-olds are the most uninsured group in this county. We can see that men are more uninsured in terms of sex, and we can see that in terms of race, the Hispanic population is the most uninsured. Something that sticks out when we look here is that the rate of uninsurance by nativity is highest among non-citizens in this county. Over half, 52% of that population is without health insurance. Now, we can select a demographic from the filters on the right side to drill down deeper and see what's going on here. So when we select that nativity filter, we see that that group of non-citizens is uninsured at 3 times the rate of foreign citizens who have already naturalized. Now, if we go to another county, say Duval County, we can see how this snapshot changes. So here in Duval County, that rate of uninsurance among non-citizens drops from 52% down to 36%. But we can also see that some of those uninsured demographics have changed. For example, the most uninsured age group is 26 to 34-year-olds like me here in Duval County. And what we're able to do is see the unique story of each county in terms of its uninsured populations. Now, there's another way that we can think about our uninsured populations, and that's through our uninsured workers across the state. Our final dashboard gives us a perspective of all uninsured adults in terms of their employment status. So the chart at the bottom is letting us look at the populations of those who are working, unemployed, or not in the labor force. And in Duval County, we see that by far there are more uninsured who are working than those who are uninsured but unemployed and not in the labor force. We can also see with the visual on the right that in terms of industry, the most uninsured industries in our county are arts, entertainment, and retail. Now, this picture changes drastically if we look at another county. For example, if we go to Hendry County, this is one of the most red-colored counties in the state in terms of uninsured adults in the coverage gap. In Hendry County, we see that over 1/4 of their uninsured workers are in agriculture, mining, forestry, and other outdoor industries. Over 1/4. And these are folks who are working in a field that have higher health risks due to physical labor, working with heavy machinery, exposure possibly to hazards on their work environment. And really what this tells us is that we can break some common misconception of who is uninsured across the state of Florida. We can see that even in Hendry County, we have a much larger proportion of people working who are uninsured. And we can see the industries where that's really affecting the population. So these are just a few of the key insights that we gleaned building these dashboards with Florida Health Justice Project and exploring the data. And there are many more. For example, in Hamilton County, going a bit west of here, we see that 15% of women are uninsured. That's higher than the rate of men, which is unusual across Florida. We can also see that in Hardee County, we have 17% of folks with a disability are uninsured, more than folks without a disability. Again, that's the opposite of what we see across the state of Florida. And in Monroe County, this is the home of Key West and a vacation destination, almost 1/3 of uninsured workers are in accommodation and recreation, the people making those vacations possible. And so really, our key takeaway from this project and these dashboards is that every county in Florida has a unique story and a unique problem with its uninsured populations. And by building these dashboards, we want to be able to tell their stories and empower Florida Health Justice Project and Floridians to be able to advocate for the counties and the populations most in need of health insurance access. And this also includes Floridians like Miriam, like Michael, like Shirley, and many, many more who can be benefited by having greater access to health insurance coverage. Thank you very much.